Hello and welcome to the Bloodstream Podcast, a show serving the greater bleeding disorders community, brought to you by Believe Limited and Bloodstream Media, and made possible thanks to our presenting sponsor, Takeda. I'm your patient, advocate, and host, Patrick James Lynch.
And I am your healthcare advocate, nonprofit nerd, and your other host, Amy Board, reminding you to please speak with a healthcare professional before making any treatment decisions.
On today's show, we've got the National Bleeding Disorders Foundation's CEO, Phil Gattone, on to talk about a whole bunch of current events, because there's a lot to talk about.
There's so much to talk about.
We've got the latest in our gene therapy segment, this time exploring the question, simply put, how do we know when gene therapy is the right choice? And is our system ready to support it? And we've got insights in this one from Stanford law professor Hank Greely and hematologist and legend, Dr. Margaret Ragni. And we have Breana Sinkfield, a community member and the founder of Hope Runs Red, who joins us to talk about Hope Runs Red. We have got all of that and more on today's episode. Welcome to Bloodstream.
Hey, listeners, as always, thank you for joining us today. If you like what you hear, please share this episode to all your family and friends on the social. And remember to subscribe so you get all of these episodes right into your little podcast player when you open your phone.
Don't forget about Uncle Tom either. Uncle Tom, he wants to get the podcast. Yeah. Aunt Lydia, she needs to get the podcast, okay? Cousin Mark.
Spider it out.
Yeah, spider it everywhere.
Yeah.
Bloodstream listeners, I also want to remind you that the podcast is indeed made possible thanks to our presenting sponsor, Takeda. Yes, that's right, Takeda. Takeda has got this website, bleedingdisorders.com, where you can learn all about Takeda's resources for and commitment to the bleeding disorders community. Takeda believes in a world free of bleeds, Amy Board.
We love that.
And they are dedicated more than ever in their efforts to offer a wide range of services and support to help patients throughout their treatment journey, wherever on that journey they may be. And you, guess what, can learn more by simply visiting where? Bleedingdisorders.com. One more time, that's bleedingdisorders.com. And for their founding and ongoing support of the Bloodstream Podcast, I would just like to say, thanks, Takeda.
Thank you, Takeda.
So, Amy Board, since last I saw you, you were in Pennsylvania for what I understand was one of the first, if not the first ever, statewide joint meeting where we had an execution of the science fair. Tell us about it.
Yes. Like many states across the country, they have multiple chapters, depending on, where HTCs are, depending on, the population of folks, or just, some, just like Ohio, there's just like 4 or 5 chapters. Yes. In Pennsylvania, there's 2, they're well-known chapters, Eastern PA and Western PA. We've worked with them both. They're fantastic. And this year they had their first statewide meeting in Hershey, Pennsylvania. So the home of the Hershey bar, there was like a guy dressed up as the Reese's cup at the meeting.
Really?
Which,
Was he handing out chocolate?
No, but there was chocolate everywhere, and the the street lamps, instead of, having like little caps on the street lamps, they were Hershey's Kisses.
Wow.
There was like a little naked Hershey's Kiss that's just chocolate, and then the next one would be a Hershey's Kiss with like the little silver wrapper with the little Hershey's thing everywhere in town. Like they committed to the bit. They committed to the bit.
Kudos, Hershey.
Anyway, it was great, and the science fair was wonderful, as always. It was so great. We had so many kids. I was just so impressed with their kid and their teen track programs. There was just tons of kids, and everybody was engaged, and their counselors were wonderful. It was really lovely. And a couple people came up to me, like it has started to happen in the last couple of years, and to say I listened to the podcast.
Hey.
Even their social worker, one of the social workers, who's like a celebrity in the bleeding disorder space, came up and said she listens to the podcast.
Well, thanks for listening, social worker from Pennsylvania. Hope you enjoyed a Hershey Kiss, Meredith.
Yeah.
Thanks for listening. We appreciate you. I was thinking about the science fair earlier. I've seen videos from the Pennsylvania science fair, but I saw there was a tissue factor pathway inhibitor Wednesday webinar from NBDF earlier, and somebody was on there explaining tissue factor pathway inhibitor and how rebalancing agents work. And one of the slides they spent some time on was 3 scales. And I was like, the scale is back. The scale, we didn't invent scales. I understand that. But I did not see these 2-sided scales in the bleeding disorders imagery and iconography or whatever until we started with the science fair. And now I'm seeing it all the time. So
it is, from a scientific perspective, of like this treatment paradigm. We have a new class of drugs coming out in the bleeding disorder space. That concept of balance and how our bodies naturally balance themselves when we clot our blood. And if you think about it, how incredible, like we have all these proteins that clot our blood, and then we have a bunch of proteins that just regulate to make sure that we don't overclot.
Right.
And researchers have gone in and, have been manipulating that system, that balance, in order to treat clotting deficiencies. And a lot of the science is really cool. We have a new we're rebooting our Ask the Expert podcast, which is all about rebalancing and the concept of this and what researchers are doing and the science behind it and clotting cascade stuff that I host. So it's a good
Yeah.
time.
And by we are rebooting, it's rebooted. It's
It's rebooted.
available.
There's like
It's
4
out.
episodes out. It's fun. Anyway, check out Ask the Expert. We'll put that link in the program notes. And Geeks Unite.
Geeks unite indeed. Speaking of geeks, Phil Gattone. Haha. Phil Gattone. He joins me to speak to me about a whole wide range of things. But before we get to him, I just want to let you know that there is a new short film out that's dedicated to moms who care for their sons with hemophilia A. It's an honest and visually striking journey about a mother going through the emotional whirlwind of raising a son with hemophilia A. This story is inspired by thousands of real moms and serves as a thank you for all they do to make hemophilia A caregiving community a place of love and resilience. You can watch this at www.hemashort.com. That's www.hemashort.com. And that has been made possible thanks to Genentech. Thanks, Genentech. And here we are with Phil Gattone. All right, I'm joined once again by the CEO of the National Bleeding Disorders Foundation, Phil Gattone. We just went through a little setup. He is not in his usual place, but he is committed to this podcast, so we figured it out. He became an electrician. It was very exciting, and now here we are. Phil, welcome back. It's good to see you.
Thanks, Patrick. Great to see you. On the road. Great to see you.
On the road. May I ask where you are and what you're doing?
I'm in Chicago. I am visiting some stakeholders here in the Windy City, and then I'm heading over to Pennsylvania. I'm going to go to Hershey Park, where our Western Central Pennsylvania chapter and our Eastern Pennsylvania chapter are having the first ever Pennsylvania statewide community education seminar, and it's going to be a special weekend for people with bleeding disorders in Pennsylvania.
Very cool. Yeah, I think the science fair is going to be there. And I'm also noting that every time I talk to you, you've come from somewhere or three, you're headed to some place or several. This has become quite a theme. Did you think you'd be on the road so much when you first took this gig?
You know, I suspected that would be the case, and I wanted it to be the case. I really enjoy it. I mean, as you know, community is everything. Community is what it's all about. And anytime we have a chance to build and strengthen our connection to each other, which I always believe is best done in person, is a great opportunity for me to listen and learn and educate myself and share some of the vision that we're working on together at NBDF.
Well, that's fantastic, and I'm just impressed with your motor. So keep doing whatever you got to do to get yours when you can, just to make sure you don't burn out. That's the only thing that I'd worry about with the schedule, the way from the kettle to the pot. Don't burn out, Phil.
Exactly. Yeah.
Well, there's a few things I wanted to talk to you about. We only have so much time, so we'll see how much we can get to. But, gene therapy is always on people's minds, but specifically from an advocacy perspective. In 2022, there was a petition to the FDA, and that predated your leadership, but it was a clear stance. It marked a clear stance on gene therapy oversight and the importance of safety and efficacy. There has been much that has changed since. So I want to ask you, where does NBDF currently stand on the safety, efficacy, and accessibility of emerging gene therapies?
Well, I think it's critically important, and NBDF is continuing to keep our commitment. We are completely committed to ensuring that gene therapies for anyone with a bleeding disorder, all therapies are safe, effective, and accessible. We did put a petition out to the FDA in 2022, but we recognize that there's been an evolution. This has been a changing, evolving process, and science and data are driving this. And we see, incredible advances that have taken place during early stages of gene therapy. It was one way. It's now there's been a rapid evolution, and we're really pleased to see that. And we're still wanting a balanced approach. We're supporting a balanced approach. We know that there has to be innovation, there has to be advancement, but we want to keep true to our values about safety and surveillance. Those are the most important things to us. And we're working closely right now with our families, with individuals with bleeding disorders, with their families, with clinicians, with researchers across the country, and regulatory agencies as well. Because they play such a critical role in ensuring the control and safety. But we just want to make sure that they're not only available for people, but they're also brought forward with transparent education and some sort of guidelines so that individuals can make really good decisions for themselves. And we encourage that. We're excited about gene therapy. We're very excited about all therapies that can help someone live an improved quality of life. So we want those manufacturers and those innovators to sustain their commitment. We want them to continue to move this forward. We want investors to continue to invest in gene therapy. We think this is critically important. Even if something isn't going to go forward, let's say something doesn't get to market, they learn quite a bit. We want that data to be preserved. We want that to be shared so that everybody can learn from each other. And I think ultimately, Patrick, we need people to be more creative in how we can bring this new therapy forward in a way that can be affordable. We can manage risk, and families can have a realistic opportunity to participate and make good decisions for themselves. I think creativity is going to be key as we move forward.
Creativity was a little bit of a theme that I identified during the World Federation's meeting last month in Dubai, in discussing how we don't want to just bring accessibility such as low dose prophylaxis. We want to go for optimal. We want to not just go for accessible, we want to go for optimal. Everyone deserves that. How we get there, we may need to be creative. So just noting the parallels in advocacy efforts here in the US, advocacy efforts worldwide, and the need for creativity, which of course resonates with me. You mentioned education in there, and education on gene therapies, of course, remains critical. 2025 is also seeing other innovative treatments and other forms of novel therapies enter the market that will continue. Shared decision making is something that NBDF has prioritized and that I believe is critically important. So my question is, how's NBDF equipping both patients and providers with the education necessary on these novel therapies, gene therapy and well beyond now, to ensure that shared decision making is truly well informed?
Yeah, that's a great question. I mean, really important time right now. My background is in marketing, and my master's degree is in education, and I come from a family of teachers. And anytime you can be more well educated about something, you're going to strengthen your ability to make a good decision. And so I want education to be kind of synonymous with the name NBDF, with our chapters, with the work that we're doing across the country. And we've made it a priority. Thankfully, NBDF made this a priority before I came on board, and I'm trying to accelerate that and strengthen that along with our teammates here at NBDF and our chapters across the country. We've expanded our education platforms to address all of these new challenges that continue to evolve in the treatment landscape. We launched a clinical decision-making tool that people can download, can look at online. HTCs can use this tool as well when they're, when those healthcare professionals clinical professionals are helping families make those decisions. They can provide that kind of a matrix to the family, to the individual directly. And we've got treatment comparison guidelines. We've got decision-making strategies across the life cycle. We had the Steps for Living launch last year, and oh my gosh, it covers everything from a caregiver of a little one all the way up to, when someone transitions from teen and tween to a young adulthood, and how to deal with all that and make decisions for yourself, all the way into adulthood and beyond. And anybody who's interested in this, all you have to do is type in your Google search or your AI, just type in shared decision making NBDF, and you'll go right to several links that will help you connect to those resources. And if you have any questions, you can certainly reach out to our team. But under the leadership of Dawn Rodolini and Kate Naumacher, everybody on our education team is not only committed, but they're passionate. Nicole on our education team is a woman living with the bleeding disorder. We have people who are so passionate about this, and it shows in the work they do. The quality is excellent, but also the commitment to making sure that we improve and we listen. Our chapters are phenomenal at delivering education to their communities, and we want to make sure they have all the resources they need to help families make good decisions for themselves, and make sure they have all the information they need.
Well, I can verify I just did it. Shared decision making, NBDF into Google. And sure enough, it brings me right to the page on the NBDF website. Very helpful. So if you do have your yearly appointment coming up, if you, like me, are curious about some of the therapies that have come out since you last switched, or maybe you never have, it's a great tool to use to kind of see where you may fit in the decision making tree, just to help clarify thinking. So thanks for highlighting that. That's an important tool.
Yeah, you bet.
I want to take a sharp left turn now and talk about some recent events in the legislative world. We've had a lot of activity on Capitol Hill, so to speak, with proposed cuts to the CDC Division of Blood Disorders and potential shifts in the Medicaid policy. How's NBDF engaging policymakers and the community to safeguard access to care and ensure that federal support continues?
Yeah, this is a big question. We could talk for hours about this. This is so critically important, Patrick. But to summarize it, so everybody can hear from me and from our organization, this is a major change and a really important one for us to pay attention to and to advocate. When we saw what happened in early April, and all of the CDC's division staff were put on leave and ultimately let go, with the exception of 2 individuals, we were really concerned, and we immediately, along with several other organizations and our advocacy community partners in the bleeding disorder space, of which I'm thrilled to be a part of, they and NBDF really went after this in a big way. We put out action alerts. We immediately began contacting congressional leaders on both sides of the aisle. Serendipitously, we had a World Hemophilia Day event at the Capitol on the 17th, and we utilized that time when we had meetings scheduled to bring forward the message of the need to restore staff and preserve funding. Because as of right now, the funding has not been cut, but we don't know where we stand. There hasn't been a new release for a new 5-year cooperative agreement. There haven't been those awards that have been announced yet that really should have been announced by now, but there hasn't been an announcement that says the money's not coming and the resources will not be there. It's just, I think we're in limbo. So we advocated really strongly to our community to get involved and speak with their legislators and their offices, because the legislators were on break, as part of this time. So that was really helpful. And then secondarily, I reached out to all of the other CEOs in all of our community partners, and there are many. And really universally, Patrick, every single CEO agreed to come together and meet. And we ended up creating a roundtable. So it wasn't an NBDF-led initiative. This was a roundtable of leaders communicating with each other, sharing information about what we know, what we're concerned about, where we can find some common ground on how we want to advocate together. And I'm so proud and thankful for the leadership in the bleeding disorders community. Just about every organization that you could think of was in that room. And we ended up creating a letter that we drafted that was over all of our signatures. We sent that to Secretary Kennedy, the head of the Health and Human Services Department, which oversees HRSA, which oversees the CDC, and we expressed our concern to the secretary, and we asked for a meeting with the secretary. And we heard back from the secretary's office, and we have now filled out that necessary form that they need in order to set up the meeting. And right now we're waiting to hear back on the date that we may be able to meet. And we'll keep you posted on that. But when we do meet, with the secretary, and we have faith that he will not only understand the importance of what's happening and what's threatened, but I think he will agree that this is not only important from a therapy standpoint, that people can get access to HTCs and get the therapies they need, but also that the blood safety issue is critically important. And we all play a role in that. And we can't do that alone. We can't do that without our federal government's help. So I believe we're going to find some real strong support from the secretary. And I'm confident that he will, not only have a good ear for this, but he will act. And secondarily to that, I just want to say how grateful I am to the CEOs of all of the organizations out there. They are working extremely hard, every bit as hard as we are at NBDF, to strengthen the community, to do everything they can within the communities that they're serving, whether it's one bleeding disorder specifically, or it's focusing on a demographic within our community. Everybody is doing the work of advocating and helping to share a common message, which is, please contact your legislator. Please let them know the importance of restoring the resources that are vital to the care of individuals, and then secondarily, to preserve the funding that supports our HTCs, that supports families, particularly when we think about Medicaid. As about a third or more of our community uses Medicaid as their insurance provider, and so
Mm-hmm.
any cuts to Medicaid can have a tremendous effect on our community. And so that's the common message: is that we want to protect Medicaid, we want to preserve the resources and restore the staff and leadership so that we can continue to do the work that we need to do together.
Wow, that's a very encouraging message. And yes, please do keep us posted on that meeting with the secretary. That's great to hear.
You bet.
And speaking of meetings, and speaking of our broader community, we've got a big meeting coming up in Aurora, Colorado. Say that 3 times fast, Patrick. I won't, because I can't. In August, it's the 77th Annual Bleeding Disorders Conference. We're still a little ways away, though not too far out. And I'm sure we'll have you back on and talking about this between now and then. But at the moment, what can you tell us? What key themes or new features can attendees look forward to? And in your mind, how will this year's meeting help deepen those community connections and further the education that we were just talking about?
Yeah, this is a highlight of our year. When we bring people together, our community comes together in a broad way, and this year will be no exception. We're going to make it really fun. It's going to be an exciting time to come together. You really want to be there this year. Thank you for being part of it last year, Patrick, and I think we're going to build on that momentum. I can give a little bit of a sneak peek on what we're talking about as far as themes and what's going to be included this year. Why don't I start with the theme? The theme this year is going to be centered on 2 words, and the 2 words are "we are." And we're going to be talking about who we
Hmm.
are as a community. We're going to be talking about who we are as individuals and what we represent in our bleeding disorders community. So when you think about the incredible bravery that young people demonstrate when they are, working through their bleeding disorder therapies and doing what they need to do to stay well, I think about the fact that we are brave. We are incredibly courageous. And we're going to tell the story about what that means and what that's all about. We are advocates, we are innovators, and we're going to be bringing this theme forward broadly. And we are heroes in many ways. The people who have been in the trenches for many decades, who dedicated their lives to making life better for people today through their advocacy in the 80s and 70s, 80s, and 90s, have made such an impact in our community. When you produced the documentary On the Shoulders of Giants, it really moved me, and it made me understand it helped me understand the the leadership that was shown in maybe the darkest of times and the most difficult of times for the bleeding disorders community, when thousands of people were losing their lives. They stepped forward, and some of those legends didn't live to see the changes that have taken place and still need to take place. But some did survive. Some did not only survive, but they championed our cause. And so to that end, we're going to recognize those leaders who played a role in making those changes over the years. And I was asked last year by a wonderful woman who had been involved in back in the day, and she asked, would there be a way that we could have a room where people who have been through all this could just get together and have a cup of coffee and say hello to each other? And we're going to do that. So we're going to have that room, but not only are we going to have the room just so people can hang out, but we're going to have a session in there so that people can really learn what these leaders did. So we're going to give that space to those legends that are going to be at BDC. But in addition to that, we're going to, if you think about the other end of the spectrum and the youth and young adult community, we're going to have a youth and young adult innovation forum, talk about those next generation leaders. We're going to have expanded tracks on mental health, health equity, access, rare and ultra rare bleeding disorders. We changed our name, as you know, from the National Hemophilia Foundation to the National Bleeding Disorders Foundation, and that's for a reason. We wanted to include more people in our community so that they feel they have a place that they belong. And we will have a dedicated space for caregivers and family members. And we're going to have learning labs focused on gene therapy, emerging treatments, clinical decision-making tools, those kinds of things. So it's going to be really fun for consumers, for healthcare professionals, for our chapter leadership. And, we're going to focus on who we are as a community and how powerful our voice is together.
Well, that's exciting. Okay, good. I'm glad I asked. So there's a nice little sneak preview. I'm glad you could tell us what you could, and we'll have you on between now and August again to
You
give
bet.
us a different look into the conference as well. I know we're cutting tight on time, but there's one other question I want to ask you, and it comes back to this idea of education and shared decision making. One of the podcasts that we produce is the Global Hemophilia Report. Each month, we're looking at a different element of science, data, storytelling, and how change is being driven by data in one form or another. And over again, we come back to this importance of the adoption of tools and best practices into our hemophilia treatment center clinics, whether it's discussion about mental health services and how that environment is just where a lot of people feel most comfortable. So how do we best support meeting people where they're at, or the direct implementation of things like a shared decision-making tool to help guide treatment decisions. With as many treatment centers as we have, and given that NBDF doesn't directly oversee or manage the treatment center network, what role can the foundation play in helping to support better adoption of our best educational tools and resources to ultimately improve outcomes?
Yeah, it's a great question. And Patrick, we don't manage HTCs, directly. That's another world, but we do play a real important role in convening and supporting and accelerating the adoption of these tools. And I know we're short on time, so I'll just say this: we continue to seek a stronger relationship with the US HTC network, and we are seeing that happen. We're so grateful for their leadership. The regional directors across the country are doing a phenomenal job of helping to provide that education in the HTCs. And then I would say our closest community partner is the Hemophilia Alliance. And Jeff Blake, who is their CEO, is an outstanding leader. He's a great man, and he's become a close friend to me. And we share a common vision and we share a common passion. And Jeff has done a wonderful job of connecting the work that we're doing into the HTCs, and we're partnering at a level that we both want to see expanded. So we both have an appetite for growing our partnership together. And we believe when there are 140 HTCs and over 100 of those are partners with Hemophilia Alliance, we want to make sure that we're a good partner to the Alliance and make sure that we do everything we can to get people connected to that integrated, coordinated care model. And Jeff has really opened his arms to us as a partner and said that whatever he can do to be helpful, he wants to do. And we're the same. We feel like whatever Jeff and the Hemophilia Alliance need from us, anything we can do to accelerate that, those tools, those therapies forward, so that everybody has a chance to live their best life, we're all in. And we're thankful for that partnership with the Alliance, and we look forward to growing that in the future.
Well, that's great. And yeah, thank you to Jeff and the Alliance for all they do for this community. I appreciate your time, Phil. Thanks for going with me on all those different areas. You were extremely articulate, provided a lot of great insights. So I appreciate your time on the podcast once again. We'll do this over the summer ahead of the conference to talk about BDC and whatever it is that may be going on in the world or in the government or wherever else at that point.
Yeah, hold on tight. It's great to see you, Patrick. We'll see you again soon.
Phil Gattone, thank you, sir, once again for joining us here on Bloodstream and covering a wide range of topics in a very short period of time. We'll have Phil back again before too long to preview the Bleeding Disorders Conference and talk about whatever it is that's going on in that week in healthcare. But let's move on to our gene therapy segment. Amy Board, what is the crux of today's segment?
Y'all, Hanna Berry is back, and she dives into one of the most important questions as we're thinking about treatment choice. How do we know specifically when gene therapy is the right choice, and is our system ready for it? And as we mentioned before, we have Stanford law professor Hank Greely and hematologist, a legend, I would say, in our community, Dr. Margaret Ragni, to explore the science, the ethics, and the real-world considerations behind this groundbreaking treatment. It's a conversation that blends heart and healthcare, because in gene therapy, timing is everything.
Welcome to another episode of Gene Therapy, A Whole New World, the segment where science meets storytelling and we unpack the mysteries behind gene therapy, one conversation at a time. I'm your girl, Hanna, and today's topic blends heart and science. What makes someone ready for gene therapy? And is our healthcare system actually ready? We're calling this one, When Does Gene Therapy Make Sense? And we've got two powerhouse guests to help unpack it all. First, Stanford law professor Hank Greely and hematologist from Western Pennsylvania, Dr. Margaret Ragni. Before we dive in, this segment of Gene Therapy Whole New World is brought to you by CSL Behring and their Gene Therapy for Hemophilia B therapy treatment. To learn more about gene therapy, hear patient stories, and view additional support resources, visit beyondhemb.com or download B Support wherever you get your apps for more information and to manage your treatment journey. So, when does gene therapy make sense? And what do doctors really consider when recommending it? Gene therapy is a potential game changer for those living with hemophilia, a lifelong condition that has historically required regular infusions to manage. But while gene therapy could offer hope, the question remains, when is the right time for a patient to consider? And what factors do medical professionals consider when determining eligibility? Let's start with Professor Hank Greely, a professor at Stanford who emphasizes that gene therapy doesn't have a one-size-fits-all answer.
So the first two words of any answer I ever should give to anything should always be, it depends, because we've learned a variety of different lessons, and not all gene therapy contexts are the same. So one lesson we have learned is FDA and the EMA in Europe are willing to approve gene therapies in a rigorous, but ultimately, I think, reasonable way. So I think FDA has been flexible.
So the FDA has been flexible, but then there's the elephant in the room, cost. Gene therapy, like many new treatments, come with a significant price tag. But what does the price tag actually cover? And how does it compare to the lifetime cost of traditional treatments? The complexity of gene therapy only amplifies these costs.
How do you pay for the development of that treatment? How do you pay for the approval process for that treatment? How do you pay for just making that treatment in a way that's affordable? And this is not just gene therapies. I mean, this is any kind of therapy for a really rare disease. Gene therapy is a little bit at the extreme edge because it is more complicated than almost every other therapy that we try. But it's a matter of degree, not a matter of kind, that differentiates gene therapies from therapies for other rare diseases.
Cost is always a major factor in medical treatments and gene therapy. Due to its complexity, it's no exception. Dr. Greely continues to shed light on the key ethical questions that we should all be pondering.
The most important ethical questions in any kind of drug or treatment development are always, is it safe? And is it effective? We often don't think of those as ethical. Those are the regulatory requirements, et cetera, but those are profoundly ethical. It's really unethical to sell somebody something that's unreasonably unsafe, or to sell them something, especially for millions of dollars.
That brings us to the heart of it all, the patient. Dr. Margaret Ragni, the medical director of the Hemophilia Center of Western Pennsylvania, is here to share with us her approach when discussing gene therapy with her patients.
To get a novel therapy, they have to understand it first, and they have to want to get it. I would never, ever consider anything unless the patient said, Dr. Ragni, I want to do this. And then I'll even stop and say, are you sure? It's not a light decision. I know some people go, I'm just so fed up with this hemophilia IVs every week or every couple days or whatever it is. And actually that does drive a lot of the interest. Of course, we want to make our lives more livable, more cured, more dependable, less risky, more enjoyable, whatever all the right words are. And so we really want to be sure we're doing this right.
Dr. Ragni stresses the importance of informed patient choices. It's not just about pushing new therapies. It's about ensuring that patients are fully educated on the risks and benefits. In her practice, she places emphasis on the patient autonomy.
It is not a rush. Why rush? They've had the disease their whole life, right? So, it's taking time to do the right thing. That's what this is about. And then the science questions can come. We can explain them simply. We can explain them difficultly, complexly, whatever is needed, whatever is the interest of the patient.
This approach is a reminder that even in the fast-moving world of gene therapy, it is essential to slow down, make sure that every decision is patient-centered. For some, that means carefully evaluating whether gene therapy is right for them.
What they notice immediately is they feel better because they're not having any more bleeds, okay? And that almost flavors everything that comes after the gene therapy. They are quality of life hugely better. Do they still have some aching here and whatever there? Yes. But the most impressive thing to me is the joy they have. They can play with their kids without worrying that they're going to get another joint bleed, or they can go to work.
So when does gene therapy make sense? The answer is complex, but both Dr. Ragni and Professor Greely agree it comes down to the personalized care, whether it's the safety of the procedure, the cost, or the patient's individual journey. It's a decision that requires collaboration across all fronts.
The patient is the center of the issue. This is about equity. Patients are talking to the physicians, to their families, to the nurses, to whomever they feel most comfortable with, or maybe the group. But we collaborate. We work together to understand it and make sure, hey, if so-and-so explains this so they understand it better than me, let's get them in there to talk and to make sure they feel comfortable about what's going on and that all their questions were answered. And we slow it down.
When considering gene therapy, eligibility can differ depending on whether it's hemophilia A or hemophilia B. For hemophilia A, factors like the liver health and the presence of inhibitors are important, especially since certain treatments can impact liver function. For hemophilia B, specific factors like a history of factor IX prophy come into play, but are not impacted by the presence of pre-existing neutralizing antibodies. While testing for these antibodies is an option, patients with positive results are not excluded from the treatment. In both cases, it's essential for healthcare providers to carefully evaluate each patient and to ensure the treatment is safe and effective.
Well, first and foremost, we want this to be a safe endeavor. So, first of all, the current gene therapy does not work in children because their cells are too rapidly dividing. So we are immediately not having children. That doesn't mean it'll be that way forever, but for right now, we don't. So we're excluding kids. If you have an inhibitor, the trouble is right now, the way gene therapy is set up, if you start making that factor, it will give you an inhibitor if you didn't have it, or if you have an inhibitor. In other words, if you didn't have one detectable at this time, but have one in the past. But if you also had one before, it may spike your levels so high, you're going to be in a little worse situation than you had been. So we are very careful about inhibitors.
Liver health is a key consideration for hemophilia B gene therapy. Before treatment, patients need thorough liver assessments to ensure there's nothing such as advanced fibrosis or active hepatitis infections going on. While many adults with hemophilia may have been exposed to hepatitis C, advancements in the antiviral treatment have improved liver health management and reduced related risks. Ongoing monitoring of liver function after treatment is also essential, as gene therapy can cause temporary liver enzyme elevations.
Most adults with hemophilia have been exposed to hepatitis C if they're 35, 40, or above. So it's not that you couldn't have been exposed to it, but you have to have taken antiviral therapy so that the viral load is not detectable. And the good news about the current therapies is they are almost universally effective. Just bottom line, we have to be sure your liver is healthy. If your liver is good, you are good to go if you don't have an inhibitor and you're the right age.
And beyond safety and eligibility, we are back to the issue of long-term cost.
So I think one lesson is the FDA process, although it can be frustrating, for the most part worked. That's not been the real problem, I think. The real problem has been more on the access, economics, and patient friendliness side. Why is that? Part of it is it's really expensive. And even though I think if it works as we hope that it will work, in the long run, it will save money, even apart from the amount of human suffering and death that it will avoid. So it's actually financially, a lot of these things, not all, but a lot of them are cost savings as well as grief saving. The fact that over 10 or 20 years, it'll pay itself off doesn't necessarily make the insurance company that's asked to pay $3 million right now happy, because they don't know whether you're going to be their patient next year or the year after, or in all those years when money savings from the fact that you're not having crises regularly add up.
While cost and access are still major hurdles, the human side of gene therapy remains key. Dr. Margaret Ragni reminds us that what truly matters is the patient, their lived experience, their well-being, and readiness for what gene therapy could mean for them.
I think what we do is we evaluate the patient. How well are they? What chronic diseases do they have, if any? How do their lab tests look? How does their physical exam look? How do they feel? But I think it ends up being more about how well is the patient and how well are they doing.
So, when does gene therapy make sense? Well, it depends. It depends on your health, your history, your hopes, your dreams, and your access. Gene therapy isn't just a treatment, it's a decision, one that calls for time, trust, teamwork, even some homework, I think. So far, we've looked at the clinical trial data, the community's response, and how hemophilia research can help advance all the rare diseases. But there's another side, one that's rarely discussed. In our next segment, we'll take a closer look at the mental and emotional impacts of gene therapy and hear from patients and providers about the unseen effects of the lifelong changing treatment. Until then, listeners, thanks for tuning in, and we will see you next time on Gene Therapy, A Whole New World. It's your girl, Hanna, and we are signing off.
Breana Sinkfield is the founder of Hope Runs Red, a community member who is a part of an organization that is student-led and making a difference. Let's learn about it right now. Hope Runs Red is a youth-led initiative that aims to raise awareness and support for people affected by blood diseases and disorders. By sharing real stories, they hope to educate others, fundraise for research support groups and care, and to inspire the new generation of doctors, researchers, and advocates. And I am joined now by their founder, Breana Sinkfield. Breana, thanks for joining me today on Bloodstream.
Thank you for having me.
So what prompted you to start Hope Runs Red?
So I have a lot of friends and family members that have suffered from different blood diseases, disorders, and cancers. And so I went into science research through my school. I researched myeloproliferative neoplasms and different types of blood cancers. And so I did hands on research with that in a lab. And I was very shocked that there weren't a lot of stories of the people with these different diseases and disorders on the internet. And it was very hard to come across quality content that shared their stories. And so I was really sitting in the lab thinking about who are the people behind the cells and who are the people behind the different diseases and disorders. So that's what really inspired me to start Hope Runs Red, to amplify the voices of these people and so that we can share their stories.
Wow. Well, that's a tremendous story. That's a great origin story. Who all is Hope Runs Red? Tell me about the makeup of the organization and the work that you're doing.
So we have around 22 members right now, all in high school, and we're from around 6 states and Japan. So we are starting to interview people to collect their stories. We're also raising money through different fundraisers. We're doing popcorn fundraisers. We have a GoFundMe set up for our money's going to the Foundation for Women and Girls with Blood Disorders. And we're also going to fundraise for some other organizations in the future. So we're fundraising through popcorn sales, stuff within school, stuff outside of school, and we're also organizing a walkathon that's coming up soon.
Wow, this is a tremendous amount of work. Do you have previous fundraising experience or organizational experience, or do team members of yours, or is this a first?
So I have a little experience from school clubs, but not much. So it's all kind of a first for me and a lot of the people in the group because we're all high school students, all starting out with something new.
Very cool. I'm curious about the stories that you've been capturing. What's something from the stories that you've been capturing thus far that's either a common theme that you've started to notice or something that's surprised you that you didn't expect when you started this initiative?
Something that surprised me that was a theme between the few interviews that we've done so far is that a lot of the people that are diagnosed with these specific illnesses or that have family members that don't know a lot about them before starting. So I've interviewed a family friend that has multiple myeloma, and she was saying that before she was diagnosed, she had never heard of it. Or maybe she had heard of it a little bit, but didn't know that much about it. And that's a common theme that with bleeding disorders and blood cancers, that oftentimes before being diagnosed, a lot of people don't know a lot about it. So that's a big part of our mission at Hope Runs Red, is to share the stories of the people and also the science and the makeup of the different illnesses so that people are more aware of what's out there.
That's great. You mentioned the interviews that you've just started to collect. So it sounds like you're early in the process. Do you have an end game or a total number that you're looking to collect? Or if you could wave a magic wand and skip ahead a year or two, where would you be in the process?
I don't have a specific number. I want to have a variety of different stories. So people with different diseases, disorders, and cancers sharing their story. I don't want to have all on one type of disorder because then we won't hear the whole picture of the millions of people out there that are suffering with these different illnesses. We won't be able to hear about all of the resilience and the battles that it took if we're focusing on one story. So I wouldn't say I had one number of people I'm looking to interview, but more I want to cover a wide variety of different stories.
Well, it's impressive work, and you mentioned you're all in high school. So when you're not working on Hope Runs Red, what else keeps you busy? What are you focusing on in high school?
What am I focusing on in high school? A lot. It's AP season right now. I'm taking a lot of AP exams. I'm also president of my school's human rights club. I'm into a lot of activism, so I'm in human rights. I'm in the NAACP Youth Council. I'm involved with Science Honor Society. I do science research at labs. So my schedule is pretty packed. So are a lot of people in my organization. We all have pretty booked schedules, but this is something that we really want to dedicate our time to because there's not a lot of stories out there and they really do need to be heard.
Wow. Well, I feel honored that we have some of your time today, and I want to make good use of it. So before we let you go, is there any message you want to leave the audience with? Anything you want to let them know about Hope Runs Red and that you haven't already shared? And please do mention the website as well.
Of course. So our website is hoperunsred.org. We're starting to get our interviews up on there very soon. We'll be sharing something about our walkathon, which is in the lower Westchester area of New York on June 13th. So we're hoping to raise a lot of money with that for the cause through walking laps, through raising awareness. But the main mission of Hope Runs Red is to share people's stories. So we're really looking for people that have stories of themselves, of family members. If you're a doctor, if you're a researcher, and if you'd like to share your story with us, we'd love to have you, just so that other people can hear about your story and so that you can inspire others can be inspired by you. We can all learn about each other, learn together, because I think that's really what can bring the community of scientists, researchers, and the people together, by knowing not just the science, but also the stories. Because through my research experience, I've learned that science and stories go hand in hand. It's very difficult to separate them. While you can, there's always a story behind science. And so that's what I'm really trying to do with this organization. And I'd love if the people listening to this could help us out with that mission by sharing their story or sharing something that they think that other people should know.
So please do visit hoperunsred.org to learn more and find out how you can share your story. Breana Sinkfield, really impressive work. Congratulations. Keep it up. And it's a pleasure to meet you. Thanks for joining me today on Bloodstream.
Thank you so much. It was so nice to meet you and to talk to you.
Thanks again, Phil, Breana, Hanna, Dr. Hank Greely, and hematologist Dr. Margaret Ragni for joining the podcast today. Thanks as always to our presenting sponsor, Takeda, bleedingdisorders.com. For more, we could not produce this show without your support, and we are grateful for it. Thanks as well to Genentech for supporting today's program, and thanks as always to CSL Behring for their support of the gene therapy segment. Bordeaux, next episode's out June 13th. What can listeners expect to hear on that one?
Well, we have a collection of patient stories to bring to you all. You really have answered the call every time we've said, like, we would love to hear your stories. Really, this has been a season of folks reaching out and sharing some really lovely, meaningful, and I think overcoming some challenges in their own stories with their bleeding disorders. So join us on June 13th for a patient story episode.
How fun is that? And with that, that is all for this episode. Be sure to subscribe to the Bloodstream podcast wherever you listen to have that next episode delivered to you the moment it goes live.
And loyal listeners, as always, feel free to email us at mailbag@bloodstreammedia.com or reach out to us on social. Mailbag. What did I say?
Mailbag. No, I'm just repeating it. Mailbag. This is all staying in. Mailbag.
Mailbag@bloodstreammedia.com, or you can reach out to us on social. We're everywhere on social. Bloodstream Media, or you can find Patrick James Lynch or Amy Board/Bradford, which is my married name.
I feel like we need a segment to discuss your journey with your name at some point.
100%.
But we'll save that for, maybe you'll do that post BDC, or maybe
Also,
Dog Days of Summer.
Just because we haven't talked about it, and I know it's like at the tag end of the episode, but I love your Knicks hat. Congrats, sir.
Hey, go New York, go New York, go. I'm sorry about your Nuggets, but New York's alive and well.
You know what? My Nuggets made it to Game 7, and
they did.
That's what they did.
They also won a championship 2 years ago, and New York hasn't even been in the Eastern Conference Finals in 25 years. So,
exactly.
Hey, let's do
this.
Anyway, before we totally get off the tracks, I'm your host, Patrick James Lynch.
And I am your other host, Amy Board.
And until next time, June 13th, they tell me, take self-care of yourself. Bye, everybody.
Bye-bye.